Welcome to another episode of Med Madness. In today's episode, we will be discussing a critical and often life-threatening condition, aortic aneurysm. We will cover everything you need to know, from risk factors and clinical presentations to diagnostic methods and management strategies. Let's dive right in. An aortic aneurysm is defined as an enlargement of the aorta to a diameter of 3 centimeters or more. There are two main types: abdominal aortic aneurysm, also known as AAA, and thoracic aortic aneurysm, or TAA. Next, let's discuss the risk factors for developing an aortic aneurysm. These include advanced age, particularly over 60 years, male sex, smoking history, which is the strongest modifiable risk factor, hypertension, family history of aortic aneurysm, history of atherosclerosis, and underlying connective tissue diseases such as Marfan syndrome or Ehlers-Danlos syndrome. Next, let's talk about the clinical presentation of aortic aneurysms. Aortic aneurysms are often asymptomatic until they expand significantly or rupture. When symptoms do occur, they can include, for AAA, dull abdominal or back pain, pulsatile abdominal mass, rapid expansion leading to sudden severe abdominal or back pain, which may be accompanied by shock, flank or umbilical hematoma. For TAA, chest or back pain, symptoms of compression on surrounding structures, incidentally found on imaging studies such as chest X-ray, Connecticut scan, or ECG. Now, let's move on to the diagnostic methods. The evaluation and diagnosis of aortic aneurysm depend on both the location and the patient's hemodynamic stability. For ALA screening, the US Preventive Services Task Force recommends a one-time abdominal ultrasound for men aged 65, 75 who have ever smoked. Ultrasonography is preferred for its high sensitivity, low cost, non-invasive nature, and lack of ionizing radiation. For symptomatic AAA, hemodynamically stable patients should undergo an urgent abdominal CT. Hemodynamically unstable patients with a known history of AAA should be transferred for emergency repair. In the absence of a known history, a focused bedside ultrasound should be performed. For TAA, diagnosis often involves chest CT with contrast to confirm findings seen on chest X-ray. Next, let's discuss the management strategies. Management of aortic aneurysms focuses on preventing rupture and addressing risk factors. For asymptomatic AAA, smoking cessation is crucial. Regular surveillance with serial abdominal ultrasounds, especially for aneurysms smaller than 5.5 centimeters. Elective repair is recommended for aneurysms 5.5 centimeters or larger, or those that expand rapidly. For symptomatic AAA, urgent repair for hemodynamically stable patients, emergency repair for hemodynamically unstable patients. Let's now move on to the complications of aortic aneurysms. Complications can be severe and include, for AAA, rupture leading to severe abdominal or back pain, shock, and potentially fatal outcomes. Ischemic colitis post-repair due to compromised blood flow. Distal embolization causing ischemia. For TAA, rupture or dissection leading to severe pain and hemodynamic instability. Compression of surrounding structures causing symptoms based on the affected area. Finally, let's summarize and conclude today's episode. To summarize, aortic aneurysms are life-threatening conditions that require careful screening and management to prevent catastrophic outcomes. Risk factors such as smoking and hypertension play a significant role, and early detection through imaging can save lives. Thank you for joining us on this episode of Med Madness. Don't forget to subscribe and stay tuned for more insightful discussions on essential medical topics. Until next time, stay healthy and stay informed. Stay